Your knee hurts. A doctor shows you an image and says the three words you dreaded. You need surgery. But what if some common knee surgeries are no better than a placebo? The science suggests it's true. Even for successful knee replacements, a surprising 1 in 5 patients are left dissatisfied with the outcome. The problem often begins with the diagnosis, where an image on a screen might not tell the whole story of your pain. Here, we'll break down the powerful, science-backed alternatives that may help you avoid the operating room. So, your doctor suggested surgery. What if the most solid evidence points in another direction first? Let's look at the top alternative. For one of the most common knee injuries, a degenerative meniscal tear, studies show a shocking result. Surgery offers no significant long-term benefit over physical therapy. Consider that. You can achieve the same functional improvement without the risks, costs, and long recovery of a surgical procedure. The body can adapt with guided movement. This isn't limited to meniscus tears. A large 5-year Medicare study found PT is a highly effective way to reduce the need for knee replacement in osteoarthritis patients. Even for severe injuries like ACL tears, surgery is not the only path. Many patients, especially with partial tears, can regain full function through dedicated physiotherapy alone. Physical therapy is a powerhouse, but it is not the only tool. So what other potent, non-surgical options can you use right now? First, the simplest mechanism: weight management. Every pound you lose reduces the force on your knee by 4 pounds. A small change gives huge relief. Next, modern injections like corticosteroids, hyaluronic acid, or PRP. These work by directly reducing inflammation and lubricating the joint for months of relief. Finally, supportive bracing. A brace works by redistributing pressure away from the damaged area, giving it a chance to heal while providing stability. So you have a powerful toolkit. PT to rebuild strength, weight management to reduce load, and injections or braces to manage symptoms. These work together for lasting change. The common thread? Faster recovery. While surgery can mean months of rehabilitation, these treatments can get you back to your life in days or weeks. With so many effective alternatives, why do so many people still get surgery they might not need or want? The answer is often in the diagnosis. Let's look at the MRI. It shows everything, including abnormalities that are completely painless and normal for your age. Think of them as gray hairs inside your knee. A doctor may point to a small meniscal tear on your MRI as the culprit, but many people without knee pain have the exact same tear. Surgery may fix the tear, but not your pain. This is vital. Your pain is real, but its source may not be the damage seen on a scan. It could be inflammation or muscle weakness, things surgery does not fix. This leads to the single biggest driver of post-surgical dissatisfaction: unmet expectations. Patients hope for a brand new, pain-free knee. The reality is often persistent stiffness, lingering pain, and limits on high-impact activity. The operation may succeed technically, but the patient's goal is not met. Beyond dissatisfaction, we have to talk about direct risks. Infections or blood clots happen in less than 2% of cases and can be devastating to recovery. For younger patients, there is another risk: outliving your implant. This can lead to a more complex and less successful revision surgery later in life. This is why medical guidelines are clear. Surgery should be a last resort. It's for when severe pain dramatically limits your life, after you've tried other treatments. This video isn't anti-surgery. For the right person at the right time, it can be life-changing. This is about being anti-premature surgery. It's a complex picture with a lot at stake. So, how do you put this all together to make the best choice for you? Let's connect the dots. Recall the MRI that shows harmless damage? And the 1 in 5 patients who are dissatisfied? A major reason is operating on an image, not a person. Now connect the alternative. We know PT can be as effective as surgery. Combine that effectiveness with a much faster, lower-risk recovery. The logical first step is clear. The ultimate insight is this: Knee pain is not just a picture on a scan. It's a complex experience influenced by muscle strength, movement habits, and inflammation. Therefore, your decision is not a simple yes or no to surgery. It is about starting with conservative care and treating surgery as a final stop you may never reach. So, when your doctor says you might need knee surgery, do not decide too fast. Pause. Remember the placebo effect, dissatisfaction rates, and the evidence for alternatives. Here is your action plan. The 3 T's. 1. Trial. Commit to a serious trial of physical therapy. 2. Talk. Get a second opinion. 3. Track. Monitor your symptoms. You are the expert on your own body. Your role is not to be a passive recipient of a recommendation, but an active partner in your own healthcare. For many, the path to a better knee doesn't go through an operating room. It's paved with informed choices and consistent effort. Start that process today.